welcome. You're watching Living with COVID. This is the show where we answer your questions on how to lead your daily life in the midst of this pandemic. We have with us Dr. Ghanshyam Agarwal. He is a consultant endocrinologist at the RP Diabetic and Endocrine Center in Lucknow. We have Dr. Sandip K Rane. He's the director of the Mumbai Heart Clinic, joining us from Mumbai. And we have Dr. Prabhu Ram Reddy, who's a consultant internal medicine at the Aditya Polyclinics in Hyderabad. Appreciate you so much, doctors, for sparing the time of day to be with us. Dr. Agarwal, if I can begin by asking you, I think one of the biggest insecurities among people at the moment, is developing any other ailment. Those who are dealing with chronic diseases at this point in time find it particularly difficult. How would you recommend that they cope?
Yeah, definitely is a COVID time is difficult for patients and clinicians. So we recommend patient to come with prior appointment, and usually they have to come with one attendant, and if possible they have to send their reports by WhatsApp or mail. And we follow 3 basic rules for all patients. One is hand sanitization before entering to the clinic, then social distancing and covering of face by mask. And after each patient, we have to just sanitize patient chair and examination equipments. And after finishing our OPD, we do thorough sanitization of our clinic and surrounding area, so that the patient feel confident and the spread of COVID is very minimal.
Dr. Rane, anything that you'd like to add about the kind of precautions that need to be taken? Especially when conducting physical examinations or tests at times like this?
Yeah, I'll tell you, we do a little different. We go specifically by appointments itself, and we give appointments at an interval of 30 minutes each so that there is no crowding in the clinic. The previous day or early in the morning, our doctor calls up the patient to take any history of the patient's got any history of cough, cold, or any fever. In case if the patient has any of these histories, then we ask them to reschedule the appointment. Then once the patient comes to the clinic, the patient's temperature and pulse oximetry is done, so as to ensure that he really doesn't have any of the problems. And then the patient is kept in there's a reception area where we maintain social distancing. However, the examination of the patient is done in a very special area, which is called as a hold area, which is exclusively one patient at a time. And during examination, our intensivist examines the patient. He is with a PPE kit. If we have to take the ECG of the patient, even the nurse uses a PPE kit. So we ensure safety of not only our staff personnel, but also the patient. The patient then talks with me on the video chat. So I have a discussion with the patient on the video, wherein I take the patient's history, his symptomatology. The intensivist then tells me the physical findings, like the pulse, the BP, and the ECG also is transmitted to me on the video call. So once I have all the parameters of the patient, then I discuss with the patient as to what change of medicines or what medicines need to be started and what needs to be changed. So that's how we ensure that the patient is safe, our staff is safe, and after the patient goes, that room is sanitized. So we take every precaution to ensure patient safety, to ensure our staff safety, and so that the next patient also who comes is safe and secure.
Dr. Reddy, is there anything that you'd like to add? What about, both the doctors have elaborated what clinics are doing, and I think every doctor and every clinic or hospital OPD are taking all the precautions. But, what about the patients? What should they be looking out for? Is it safe for them to avail of other healthcare facilities at this time?
We follow 3S at both my clinics. That is, 1S stands for the screening, sanitization, and the segregation. So the screening, there is a special desk is made at the outside of my clinic. So the patients, whoever comes to that, so we measure the temperature, pulse, and saturations. So there, if the patient is having the 99-degree temperature and the pulse is having the above 100 and the saturations falling between the 90 and the 94, these patients will be segregated into a COVID suspect patient, and those patients who have got the normal vitals, they are segregated into a non-COVID patients. We made a policy that every patient should enter with the surgical, three-ply surgical mask that should not have any valve. So we are strictly not allowing the patient with the cloth mask. Why? Because if there is any cloth mask with valve or the N95 mask with valve, there will be a lot of virus spreading outside and causing the harmful to both the other patients and even the healthcare professionals, even the receptionist, and even the IMS who are working in the clinic.
All right, that's very interesting. So you're actually saying that you're specifying the use of mask as well, when you are entering a public area. If you could just elaborate a little bit, Dr. Reddy, on mask etiquette as well.
There are many kinds of masks available in the market. Coming to the cloth mask. So cloth mask is very, very safe when you are able to maintain a social distancing, like when you are walking or when you are doing some kind of yoga or gym in your home vicinity where there is a minimum people around you. There you can use the cloth mask. So when you are failed to go for do the social distancing, like when you are coming to the clinic and the hospitals and the malls, visiting the stores, there I personally feel don't help your cloth mask. There you have to wear a three-ply surgical mask.
Right.
That will prevent further transmission from the COVID suspect to the non-COVID patients.
Very briefly, if I could just ask you another follow-up question. What about face shields? Is a combination of a cloth mask and a face shield effective?
Yeah, there are some studies available in 90s and before that, even the Spanish flu has existed in the previous. So there they did a study that the people using the cloth mask and the shield and the people using with the surgical mask and the shield gives you the same result with the shield. So
all
shield
right.
is very protective in
all right. So face shields are something that are actually very useful. But again, in taking it off and cleaning your face shield or reusing it, if you have to be extremely careful. I think that's very important perspective. Dr. Agarwal, if I can come to you at this point, let's just shift our focus and talk about diabetes patients. When should a diabetes patient come for a follow-up test? What are the telltale signs of an emergency that a diabetes patient should be looking out for?
Yeah, it's very important for diabetic patients. First of all, they have to maintain their sugar, like fasting sugar below 120 and postprandial below 180 and HbA1c below 7%. So there are certain problems which we recommend them to go emergency, like loss of consciousness. It could be because of low sugar or very high sugar. Then any kind of chest pain, any kind of infection leading to fever, and any kind of urinary problem, and any kind of pneumonia. So these patients immediately rush to hospital or emergency. So in emergency also we have to differentiate between COVID and non-COVID. Accordingly, we have to admit these patients.
All right, Dr. Rane, what about those who are suffering from heart diseases? How do you recommend that they manage heart diseases at home, or they manage their condition at home? And again, what are the telltale signs that they should be looking out for when they need to seek medical attention?
Actually, in this period, patients with heart problem, they are quite scared to report to the hospital. So we have to establish better communication lines with our patients. So all our patients who are discharged from a hospital, they have a 24-hour helpline from a hospital, which they can access anytime. And then at the time of discharge, we give them instructions that they need to follow their medicines properly. If they have any chest pain, they need to call up the hospital and get instructions about the chest pain. Or if they have any evidence of any breathlessness, again, they need to call up the hospital. Not only that, my number is available to them, so they can SMS to our hospital or to my personal phone line, and within 15 to 20 minutes we'll reply as to what is the next step that needs to be taken. And if after taking the initial steps, if the patient still does not have any relief, we've asked them to report to our casualty immediately so that we can take the necessary steps to prevent further progression of the problem.
All right, Dr. Reddy, we've spoken extensively about the importance of masks, the different kinds of masks, but many people have, queries on the types of masks. I know that you have elaborated on types of masks. You've also elaborated on use of face shield. But I think the other important issue that we really need to touch upon is when to clean and how to sanitize a mask. So, mask sanitization or mask etiquette, and even in the case of face shields, what do you recommend?
Exactly. During the critical situations like this now, the availability of the surgical mask and the N95 mask is very, very difficult. So majority of the people think that the surgical mask, once you use, you have to throw out. This need not be. So you can cut down your expenses on the mask purchasing. Very, very simple techniques. Right now, what we are recommending to our patient is, number one is the microwaving. So number two is the microwaving with steaming. This microwaving steaming is a very, very new technique which is very well endorsed by the American Society of the Microbiology, which is inexpensive and ready to use your mask for the next day. So what we do is, when you have a surgical mask or the N95 mask with the metal nose bridge and the normal strings can be used for the sanitization, putting 1 minute in the micro oven. So I advise not to put N95 mask which is having the elastic rubber band strings, because it gets dissolved in the micro oven. This is one of the least inexpensive way to sterilize your surgical mask.
Okay.
Coming to the steaming, so you take some kind of a Tupperware box, put it in water, place a mesh-like cloth over there, put it into the micro oven. On the top of the mesh, you just open your 995 mask and keep steam for 3 minutes. Because of that steams, it gets clearly sanitized. So the research said that even after doing the steaming, so whatever the components of the N95 mask or the surgical mask are very, very intact, and it's very safe to use for another 4 to 5 days. So there is another way of using the mask. If you are using the mask, surgical mask or the N95 mask, so make each mask or the surgical mask on the N95 mask, code it like Monday, Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday.
Right.
So when you are going for the work on the Sunday, you take the Sunday mask and keep it in a hanged position way. Second day, you take the Monday mask, and once you come back from your home, come back to your work, so you can again put it on this. Like this, the novel coronavirus stays on the mask up to 72 hours. So this is another way of using the N95 mask for the prolonged times. In my opinion, the N95 mask can be used.
And can you wash cloth mask regularly, like how you wash any other piece of cloth?
Yes, the recommendations washing the cloth mask is like as you wash your clothes in the washing machine can be used in the same way. There is no need to do any precautions.
Okay. All right. Appreciate you, Doctor, for clarifying that. I think that's something that is very useful information to all our viewers. We're all using masks on a daily basis, and using several different types of masks actually on a daily basis. We're going to slip into a very short break at this moment, but our panel of expert doctors will continue to be live with us on the other side. Stay tuned.
Knowledge Partner, USV, your reliable healthcare partner.
Welcome back. Dr. Agarwal, if I can begin by asking you, many people think that consuming multivitamins and other food supplements can actually prevent COVID-19 or prevent a person from contracting the infection. Is that true?
Yeah, this is very interesting in fact. But this is not true. Any kind of vitamin or food supplement will not prevent corona or not cure corona. So in fact, there is some studies which have shown due to vitamin D deficiency, there is a severe form of corona and with more mortality. So definitely we have to supplement vitamin D and C. But definitely good nutrition and exercise, which causes immunity booster. So we have to advise like high protein diet with lots of fruits and vegetables. So this will help in increasing immunity and prevent corona as well as the severity of disease. So I would recommend there is no need for any food supplements or vitamin supplement. You have to take very good diet and do exercise for 30 minutes. That also increases the immunity, and proper sleep is also very important to increase your immunity. So these three things are very good for prevention of disease.
All right, Dr. Rane, a lot of our viewers have actually asked this question. The symptoms of the COVID-19 are awfully similar to that of a common flu. And with the season change and with the onset of the monsoons, these symptoms are quite common. And you're from Mumbai, you perhaps see it around you all the time. With the onset of the monsoon, people do contract some kind of a flu infection. How can one distinguish between what's a common flu and what is actually COVID-19?
Actually, that's a real dilemma even for the medical professional. But I can give you very simple clues as to how you can differentiate whether it's likely to be influenza or a COVID-like fever. What is very important for one to monitor is oxygen saturation on a regular basis. If you find that the oxygen saturation is dropping down, and if it is less than 94%, then you should report to the hospital immediately. There is one very definitive way of differentiating influenza-like fever from a COVID. The second most important thing is your temperature. In fact, if you find that you have got fever for maybe 48, 72 hours, and if it goes away by some medicines and doesn't recur, then you are likely to be influenza fever. But if the fever persists for maybe more than 72 hours, maybe 4 days, 5 days, then you need to go and get yourself checked up for COVID. In the other preliminary symptoms, like if you have COVID, you have involvement of your throat, but that is more of dryness rather than a productive cough. Or if you have symptoms like running nose and frequent sneezing, it's more likely to be influenza than a COVID-like. Some of the new symptoms which are there in COVID are especially loss of smell, loss of taste, and unusual loss of appetite. So if you have these symptoms vis-a-vis the regular fever which lasts for 48, 72 hours, running nose, productive cough, then the earlier symptoms go in favor of COVID. Whereas if you have the latter symptoms, it goes in favor of influenza. But I think if you have to take the prime symptoms, one is fever which persists beyond 48, 72 hours. Second is you have a saturation which is dropping down, and a dry cough, then you are likely to have more of COVID rather than influenza itself. And the fourth most important is evidence of breathlessness.
Right.
If you start developing breathing problem, that would go in favor of COVID.
All right. I think, those are very crucial indicators that people can, in fact, watch out for. Dr. Reddy, if I can come back to you, once again to shed light on sanitization of gadgets, your wallet, your mobile phone, your car keys, things that we carry around us all the time or we carry on ourselves, on our person all the time. How can one sanitize those effectively?
The UV chambers, the cost of the UV chambers are not that expensive. It's almost like, the portable UV boxes are like around 5,000 to 7,000 rupees. So this is one way of sanitizing your belongings. Even it can be used. There are so many wide variety of gadgets. UV boxes are available even for the personal use and the clinical use. What in my clinic we use a Corona oven, which is a ultraviolet box. We keep all our staff masks and the BP apparatus, thermometers, everything will be sanitized in that. This is one way of sanitizing your belongings and your clinical equipment. The second is when you don't have access to this, you just carry a small pieces of cotton and carry some kind of alcohol-based sanitizers. So when you are used up, so put it on this gel-based alcohol sanitizers, and you can clean up with your mobile phones and your belongings. And there are so many sprays are available. So once you come back to your home from your work, so you can spray on your bags and your wallet. So what I advise is when you are using the mobile phones, use some kind of plastic covers over that.
All right. I think that's very useful advice, and also in a bid to over sanitize, don't end up ruining your phone. That's, I think, very important as well. Dr. Agarwal, if I can come to you at this point, conditions like thyroid or PCOS, PCOD are common in many women. How can you manage these effectively at home, and what are the steps that you can take, to reduce the susceptibility to COVID-19? Do women with these predisposed conditions actually have susceptibility to COVID-19?
Yeah, the hypothyroid and PCOS is very common in women, and these are the conditions in which patients should not stop their medicine. That is the most important thing. And in fact, if they are taking medicine, if there is no problem, they just continue their medicine. If any new symptoms occur or any problem occur, they just take one teleconsultation and call their physician. So they usually resolve by telephone. And if there is need of any investigation, they just go for investigation and show their report on telephone or WhatsApp. So the important thing again to prevent corona in this patient, we have to just avoid going outside without any work, maintain social distancing, and use face mask whenever they go outside, and proper sanitization of their hands. And in fact, there is not so much susceptible of corona in this patient like diabetes.
All right. Dr. Rane, if I can give you the last word then, what's the kind of advice that you would like to give patients who've recently undergone cardiac surgery or procedures like an angioplasty or a bypass, especially patients who've recently undergone these procedures and also patients who've undergone these procedures in the past?
Yeah, I think that's a very difficult problem for the patients because communication, traveling is a problem. However, we have maintained good lines of communication with our patients. They can contact us on our 24-hour helpline. And you'll be surprised that despite the lockdown, we never had a hospital OPD shut down for a single day also.
Okay.
So we still maintain our OPDs. We allowed our patients to take appointments, come to our routine OPDs at appointed times. And even if they had to come in an emergency, we had emergency services 24/7. However, better communication lines, giving them proper instructions how to take their medicines, and a proper follow-up with whenever they have any symptoms, they could call us up and we are available 24/7.
All right. Appreciate you, doctors, for sparing the time of day to answer our questions so very patiently. Thank you so much for being with us on the show.
Knowledge Partner, USV, your reliable healthcare partner.